Hello, good morning. I am Dr. Bishash. I am a doctor of this clinic. May I confirm your name in place, please?
Yes, doctor. Good morning. I am Dr. Mr. Lex Luther, 24 years.
Okay, so how can I address you?
You can call me Lex.
Okay, Mr. Lex, how do you feel now?
Well, doctor, somehow it's going on. Actually, uh, you know that I have been suffering from some tummy pain on and off. So I'm somehow going on now.
So, is it appropriate time to discuss about your condition?
Yeah. This will just come and go, doctor. I have been suffering from this for quite a long time. So I'm ready to talk.
I'm sorry to hear that. And I am going to discuss about your condition, and all the information during your discussion will remain confidential. So, is that okay for you?
Yes, doctor. It's totally all right.
So, can you please tell me in your own words what is happening with you?
Well, doctor, actually, I think it's around 10, 12 years now. It's a long history, doctor. Uh, just at times I feel some severe tummy pain. It's usually at my upper tummy, okay? And it just comes all of a sudden. And I usually go at that time to my GP to uh, have a look at what to know what's happening. So they have actually they give me some medication, and also at times usually when I have that tummy pain, uh, many of that times I have also noticed that there was some yellowish discoloration of my eyes. Okay, so this thing I have just this is going on for quite a long time, and uh, my GP has performed some blood tests on and off, and almost all the time I think he has told me that I have some problem with my bloods. Okay, with my blood, and usually my blood is less, and and uh, I have also received some blood through my blood channels. Okay, I think 6 to 7 units in my life. So that's what, and this pain doesn't go away usually. This stays. This is not every 1 or 2 months. I feel this pain.
I'm sorry to hear that. Can you tell me exactly that where do you feel the pain? Can you show me the site?
I think, doctor, it's right upper tummy, doctor.
And you said that this started about 10 to 12 years ago.
Yeah.
Do you think the pain is always on the same position?
Doctor, more or less on the same position. Sometimes around in the central part of upper tummy, but more or less, I think it's in that zone.
And when the pain is such, how long does it persist?
I think for 1 or 2 hours,
Then
and
it's
it's actually a very severe pain, doctor. It just comes in waves, this pain, and I just feel like so much severe pain at times. I just feel like, is there anything special to get rid of this pain?
can you tell me that how do you feel the pain or what feeling about your pain?
Yeah, I told you, doctor, it's very severe. It just comes in waves. Okay, like a one wave comes, I just feel so much tired, hectic with, and and sometimes I have to shout in the pain, and again it goes, and again comes the waves. This states for this actually continues for around 2 to 3 hours.
Does this pain go anywhere?
Sometimes I think 3 or 4 times I have also felt that it goes up to my shoulder, right shoulder.
I'm sorry to hear that. And when this pain comes, you said that you notice also the increased discoloration of your water work.
Mm. Yes.
Have you noticed anything else? Any feeling of throwing up?
No, I have not felt like that.
Any changes in your bowel work?
My bowel work has been more or less good.
Any? Have you noticed any blood in the bowel work?
No, doctor.
Okay. And when the pain comes, have you noticed any lump?
No, doctor. I have noticed some.
Okay. And does this pain have any timing that when does it come? Any specific timing, or it can come at any time?
I think, doctor, whenever I have some other infections like any runny nose or any type of infection or any raised temperature, I think this pain actually increases.
Okay. And have you noticed anything that brings your pain? You said that some runny nose. Anything else like eating some kind of food, eating a special kind of food, any
Yes,
weather?
I sometimes think
Yeah.
that yes, sometimes I think that when I have some large meal with some oily food, I think it increases a bit.
Any in any weather,
Sorry,
any specific weather?
well, I haven't noticed, doctor. Actually, I have reside in such a hot climate country. I have noticed.
Have you noticed anything that makes the pain worse?
Yes, I told you that when I have some infection, I think it gets more and more worse.
Okay. And
And having this type of,
anything makes it better?
well, usually not, doctor. I have to go to hospital most of the times, and they give me some, I think, some painkillers through my blood channel, and then usually I get better.
Okay. And if I tell you to score your pain from 1 to 10, where 1 is the least severe pain and 10 is the highest severe pain, how would you score your pain?
I think I would score 7 to 8.
Okay. And you also have some yellowish discoloration. And do you feel every time you feel the tummy pain?
Many times, not every time. I think that many times I noticed.
Any raised temperature during that time?
I told you, doctor, that sometimes it occurs when I have some raised temperature. All these problem occurs when I have some infection, some raised temperature. I told you.
Do you have any headache?
Not now, doctor.
Any changes in your vision?
No,
Any rash?
not rash, doctor. But I think I have some. At times, I have had some several episodes of ulcers in my leg.
And which part of your leg?
I think, doctor. I think it's my leg. It's the right leg or left leg. Both legs have been involved several times.
Have you noticed anything that you feel pain on your ulcer, or the ulcer becomes blackish?
Sorry.
Any your ulcer become blackish and you have so much pain in your ulcer?
Yes, doctor. I feel pain in my ulcer at times. When usually all these symptoms come one after another or at the same time. Okay.
Any changes in your skin? Any skin tightening?
No, doctor. I have noticed.
Any pain on exposure to cold?
Well, I told you you asked it before, but I haven't been exposed to cold that much in my life.
And how about your appetite?
It's quite good.
Any weight change have you noticed?
No, doctor.
Do you have any weather preferences?
No,
Do you have any cough?
not cough, doctor. But 2 times I remember when I had this type of problems. I also had severe shortness of breath, and I had to go to hospital at the same time, and they gave at the same time painkiller, and I had to take oxygen and also I think some antibiotics.
Okay, I'm sorry to hear that. And when the last episode happened?
Around 2 years back.
And do you have any racing or pacing of your heart?
No,
Do you feel any frequent chest infection or any runny nose, any cough?
so at times I told you that this chest infection, it's actually these infections are increasing day by day. Usually, what happened 5 years back, for example, I had this type of infection only once or twice a year, but now I think during the last 3 or 4 years, I think it has increased up to 4 or 5 times a year.
Okay. And have you noticed any lumps or bumps in your body?
No,
How about your water work?
quite good, doctor.
Any weakness at any side of your body?
No,
Have you ever had?
no.
Do you have any past medical history as you are being admitted so much time? Did you do any test?
I think they did some tests, doctor, but I'm not that much literate. I reside in a village. I don't know the details, but I think they ran some tests, and told me that I have some problem with the blood, and I might have to carry on with this treatment. They told me that at the village level there is not so much well treatment in those clinics. So they told me that I have to continue it for a long time. This blood taking or something like that.
Uh, do you have any known medical condition?
No,
Can you show me your medication list?
uh, there is actually nothing, doctor. Actually, sometimes I take iron tablets, and when I feel this problem, I usually go back to hospital, take some painkillers. That's all.
And do you have any allergy to any medication?
No.
Do you take any over-the-counter medication?
Well, doctor, allergy. Well, doctor, one I have to know to tell you one thing. That once actually I had some problem with my chest, and I think they gave me some penicillin or something like that. I think I am allergic to that. They told me that, and I got bad after taking that medication.
Okay, I will point it out. And do you take any over-the-counter medication?
No,
Any herbal products?
no,
Okay, I am sorry to ask, but can I know that do you take any blood cell medication or any IV drugs?
no.
Any of your family member have this type of condition?
Well, when I asked my parents, they told me that actually I think my maternal uncle had this
And
type of problem with his blood. Okay,
any history of sudden death in your family?
no,
Any history of death at childhood?
no.
May I ask you a few more personal questions?
Yes, of course.
Do you smoke cigarette?
No, doctor.
Do you drink alcohol?
Within the social limit, doctor.
And what do you do for living?
Doctor, I live in a village. I told you, and I just do some farming.
Do you need to expose to any pesticide or any chemicals?
Yes, doctor.
Any late products?
Yes, doctor. I think some pesticides I have to give at times to my field.
Have you noticed that this brings your symptom?
I haven't noticed it actually, doctor, because I haven't taken care of that.
Okay, that is not a problem. And may I know that what is your concern?
Well, doctor, actually, I have come after such a long time to the city here in this type of hospital to actually map out the plan. So the doctors have always told me that this will go carry on for life. So, what is this actually, doctor? Can I have any good cure or good treatment for this? I just want to know.
Okay, actually, I am not quite sure. I need to examine it, then I could give you the better explanation. But at this point, I have some possibilities in my mind that there may is possibility of having that your bloods are breaking down than the normal. So you are having those
Hello.
problems. There
Okay.
might be some problem with your blood shape. This is a possibility, and also
Mm.
there is another possibility that you are a farmer and you are maybe exposed to some chemicals, so that you may get this type of symptom. Okay,
Okay.
and also as your uncle had this type of symptom, there are also other possibilities. That is some chemicals that are being formed excessively in your body. So I think there are a lot of possibilities, and for this we need to run a few blood tests, and after that we can give you the best explanation that what is happening with you.
Okay, doctor. Okay. So, what do you think that can I be treated?
After the test results come, I can give you the best explanation. At this point, I cannot tell you exactly because I am not exactly sure what is happening with you.
Well, doctor, do I need admission?
Uh, at this point, I need to examine you, and then I could give you the best explanation. I need to examine your blood pressure, examine your tummy, then I could give you the best explanation. And I think you might need admission.
Okay, doctor. That's all right.
Do you have any other question?
No, doctor. Thank you. Well, so what are your duties here?
Okay, for this gentleman, my differentials are this is can be a case of sickle cell anemia, then can be a case of porphyrin metabolism abnormality. I cannot exactly remember, and also I think this can be a case of chronic lead poisoning, and can be a case of hereditary angioedema.
Okay. Hereditary angioedema.
Yes, for his recurrent
Okay.
abdomen.
Well, okay. Okay. Okay.
And also I
Well, but
will
hereditary
consider
angioedema, do you usually?
cryoglobulinemia.
Sorry, sorry,
Sorry.
sorry.
I will also consider cryoglobulinemia.
Okay, that's very good. Well, what investigations would you like to consider in this patient?
For the gentleman, I will go for the complete blood count to see anemia and white blood cell count level, then peripheral blood film to see any type of morphology of the RBC, then any late dots or any abnormal parasite on the red blood cell, then inflammatory markers like ESR and CRP. Then I will also go for the liver function test, renal function test, urine for routine examination, and random blood sugar level. In the meantime, I will also go for the serum immunoglobulins level and imaging test like ultrasonogram of the abdomen and
Okay, that's all right. Well, I think regarding that you had told me some TBs. I think you can do some specific tests like sickle cell EMA test used in Malin test. I think EMA test, and that's I think important. I just can't remember at this moment. For cryoglobulinemia, I think complement level is important, and also hepatitis B C levels, viral status can be important there. And for hereditary angioedema, also C1 esterase inhibitor level I think can be done. Okay, and since you told about some porphyrin, I think urinary porphyrin levels can be okay.
yes.
Yes, and considering that it's a sickle cell disease, if you consider sickle cell, so how will be the management?
First, educating and counseling the patients, then some non-pharmacological managements like uh, avoidance of excessive cold or any condition that provoke his symptoms, and also involvement of the multidisciplinary team like a hematologist for his better management, and if he have any history of recurrent abdominal. If as the patient have history of recurrent abdominal pain, so I'll go for the if it is case on recurrent cholecystitis, or it is a case of splenic infection, and on that I will need to take surgical opinion for that.
Okay. Okay, that's all right. Can you okay? And any other
Yes,
thing?
for emergency management, for his pain management, going for the opioid analgesic, maintaining of his well hydration, and also blood transfusion to keep his hemoglobin level at normal level, and also
Okay.
management of his any signs of it, if he has any signs of infection.
Yeah. Well, okay, do you think that any prophylaxis, anything is needed in this patient?
For this gentleman, I think prophylaxis with some pneumococcal vaccine,
Yeah.
influenza vaccine.
Yeah. Okay. That was very much important. Okay. And another prophylaxis, can you ever think of like the hydroxycarbamide or something like that
Uh,
for long-term use?
yes, hydroxycarbamide will help to produce more
Yeah, yeah. It will
RBC.
actually cause more production of hemoglobin F, okay, which will actually help to reduce the sickling tendency. It actually hydroxycarbamide produces more hemoglobin F, and what happens is that hemoglobin S has more sickling tendency, but when hemoglobin F is produced more, this sickling tendency actually goes down. Okay,
Okay.
so this is good for that. Okay, and okay, this has been a very good case presentation. But
Okay.
I just want you. Okay, hello.
I have a question that for the gentleman, will I go for the rheumatological conditions like something like SLE can be SLE can be a
Hello.
for this? Hello?
Hello.
Yeah, I can hear you.
Yeah, yeah. Can you please repeat for rheumatological conditions like?
Like, can I keep SLE for this gentleman? SLE
Yeah,
differential.
you can. Yeah, yeah. You can. Why not? You can keep abdominal pain. I think tummy pain, abdominal pain can occur in easily. Vasculitic feature can occur,
Okay.
can't it? I think you can tell, and I think you can. But there are some points actually I would like to point out that you missed. Okay, 2 points specifically. I think you didn't ask about joint pain. You missed that point. Okay,
Yes.
and when you asked about joint pain, I would have told about the symptoms of dactylitis. So that is very important. Okay, in sickle cell disease, there usually is dactylitis because there is painful vaso-occlusive crisis. There is severe pain and there is severe swelling in the fingers, sometimes deformity. Okay, so I would have told you that. Okay, and around about the calf, I actually told it myself that there are some problems about it. Okay, some repeated chest infection, sometimes there was severe. That's another point. You missed another important point. I think that examiners would like to listen about it. Any severe pain in the private parts, priapism.
Yeah, yeah. I just remembered, but I forgot to ask.
Yeah,
Just
yeah,
it
yeah.
was up at the
I
time.
think when you had asked about these points, like any joint pain, and how about the joint pain or detailed thing of joint pain, and about any severe pain in the private parts, I think the diagnosis would have been much more straightforward.
Yes,
I think so. Okay,
painful area.
because these points are because these points are very very specific, because like priapism, it's just occurs in leukemia and this thing, and then I think leukemia wouldn't have been much more possible case in this patient, but sickle cell would have been much more possible. Okay,
Yeah,
and leg ulcer I told it myself, but I think you should have asked about priapism and dactylitis. These two things had been very much helpful to you. Okay,
yeah.
yeah, and otherwise the case has been good and very good. And I so what about what occurs is that I you told very good well that what about the symptoms, where is the symptom. So I think that there is some pain, gallstone pain. Okay. So I actually told that colicky pattern that it comes in waves and very severe. So that was all right. And then you asked about blood transfusion. That's very good. But in the treatment option, you can also tell that when any stroke feature is present or not, we can go for exchange transfusion. You can also tell about that. Okay. If any times he has any stroke feature, I think exchange transfusion is an option. So these three options, I think, should be told in the treatment part. Like we can use hydroxycarbamide. Okay, we should use some prophylaxis considering his splenic function, and we might also consider for transfusion, exchange transfusion, if any stroke features are present. Okay. Hello.
Yes.
Hello.
Yes. Yes. I
Yeah,
can.
yeah. Okay. So that's all I think. Do you want to add anything?
I wanted to add just think that complement deficiency. Is there any complement deficiency that can present with in this way? I cannot remember much about that. So I just
No. I think cryoglobulinemia is associated with complement deficiency. I as far as I remember.
okay. And
Since you told about cryoglobulinemia as a DD, for that reason I told you. Okay. Hereditary angioedema can, I think, be associated with C1 esterase deficiency, I think. And cryoglobulinemia, as far as I remember, there are some complement problems, C2, C4, like that. Okay.
for this patient, is there any chance of developing mesenteric ischemia? That this type of patient.
Yeah. Yes. Why not? I told because as far as I know, it can occur
Okay.
because
Does
there
this
it
patient need
can be
any
hospital.
aspirin or anticoagulant?
I'm not sure about that anticoagulant. I haven't read about that in the literature. Okay, I'm not sure about.
A hematologist, so I'm asking.
No. I'm not a hematologist. I'm just
Okay, fine.
okay. So I think that's okay for today. For this case.